Welcome to the Dr. Nurse Paul Show, hosted by Aspire RN and Dr. Paul. You are watching The Secrets of Next Generation NCLEX. Dr. Nurse Paul is an NCLEX expert, having trained and mentored thousands of international nurses past the NCLEX RN for over a decade. He graduated with a Doctor of Nursing Practice in Texas Christian University. He is a registered nurse, an advanced practice registered nurse, and a certified family nurse practitioner. He also has completed a Certificate for Nurse Educator postgraduate course. Aside from teaching, he has extensive clinical experience in emergency and family medicine. He has over 15 years of combined clinical and academic healthcare experience. Dr. Nurse Paul is an immigrant from the Philippines. He is currently based in Houston, Texas, where he operates his business, Dr. Nurse Paul and Aspire RN NCLEX Prep. He loves to share his life story of how he overcame his challenges to reach his dreams. He is passionate in helping nurses realize the American dream. So without further ado, let's all welcome Dr. Nurse Paul.
There you go. Can you guys hear me? I'm so sorry. I'm having a lot of technical issues right here. But if you guys can hear me, please say yes on the comment section. I'm so sorry. I have to restart my camera multiple times. So I don't know if I'm currently live right now. So I'm so sorry. I've been trying my best. I have a lot of things going on right now. I've been online since 20 minutes earlier, and the audio and video check prior to the start of the show was doing well until, of course, when we went live. Thank you so much, everybody, for hanging on with me. I had to exit and come in again to the um, podcast application multiple times, and I'm still over here working with my team in the background. Thank you guys for staying. And I'm kind of using my computer camera right now, which is really not the best, but I think my camera broke down as well. And thank you guys for staying. Anyway, let's start the Dr. Nurse Paul show. Thank you guys for hanging on. We are going to do the secrets of next generation and clicks today. This is our season 2, episode 2. Last time, which is on the first Saturday of January, I was not able to do my live show, although we telecasted it as though it was live because I was on a trip to the Philippines. And today I'm still here in the Philippines. I'm over here for 4 weeks. I surprised my family and my friends, and I'm visiting the house that I built for my mom. And that was also a surprise. I surprised my mom. I surprised them that I'm here, and it was really fun and happy. And everybody's happy that I'm back. Of course, I'm also happy that I'm back. And I got a little tan because I just came back from an island tour from Coron, Palawan, which is really nice. And internet issues is one of the reasons why I couldn't come into the live as fast as I could. And then, of course, it was working fine until the actual show started. When the actual show started, it kicked me out, tried to come back in, kicked me out again. But thank you guys for hanging along, all right? Today we're going to talk about the secrets of next generation NCLEX. Let me check my slides again. And it's going to be right here, right? Okay, so today we're going to talk about the secrets of next generation NCLEX. We're going to talk about trends and bow ties, which are types of questions that we are going to see in the next generation NCLEX. In the past, we've talked about case studies. Today, we're going to talk about standalone questions. And don't worry, we're going to answer your questions later. This is going to be a very interactive show. I'm going to flash two types of questions and we're going to answer it live. So please tune in if you are taking your NCLEX after April 1, 2023. Just be aware that we are going to do the next generation NCLEX. All right. So anyway, for tonight, we are going to have a giveaway of an Aspire RN NCLEX review package for good for 1 year. So tonight there will be one winner of an Aspire RN NCLEX review package. If you want to be a winner for tonight, all you gotta do is three things. One, like the Dr. Nurse Paul and Aspire RN in Facebook. Number two is share this live show to your pages and make sure it's public so we can actually see you guys that you've shared this show. That's one way for my team to verify that you've actually have shared this show to your page. And number three is to comment hashtag Dr. Nurse Paul in your comments in the comments section. All right. So go ahead and share it now. Right. Go ahead and share it now. And hashtag Dr. Nurse Paul in your comments if you want to be one of the lucky winners. We have some people doing it already. Thank you guys. All right. Make sure that you guys, if you want to share this show, make sure that you have shared it publicly in your pages. That's the only way for my team to know that you have actually shared this show in your page. If you're in a private mode, you're not going to be able to see it. Okay. And the only way to share this if you're joining from other pages like the Aspire RN page, which we're also streaming live in my YouTube page, which we're also streaming live and in Lefora page, the page that I administrate, that we're also live streaming there. Please go to Dr. Nurse Paul and Facebook right now and share it from the Dr. Nurse Paul page. That's the only way for my team to verify that you've actually shared it, and that's the only way to actually join the promo, right? And we've already have a lot of winners. I mean, we have a lot, not winners. We have a lot of people that are trying to join us today. All right. Some people are asking if I have audio or can you guys hear me? Can you guys please message me if I'm having issues with audios, if you guys cannot hear me clearly. Okay. So again, to join the review package giveaway, all you got to do is follow or like Dr. Nurse Paul and Aspire RN in Facebook. Share this show from the Dr. Nurse Paul show page to your profile pages. Make sure it's public and comment hashtag Dr. Nurse Paul. All right. So some people are saying I'm loud and clear. Some people are saying it's no audio. Can you just please refresh your screens? There might be a lag with what I'm doing right now. And to people who are in other parts of the world. Okay, so many people are joining today. Thank you. All right. By the way, before I start with our show today, can you guys tell me which places of the world are you guys watching from today? From where are you watching from today? Can you let me know? If you guys have not heard my introduction, I'm over here watching from the Philippines, my hometown, my home country, and haven't been home for 5 years. I was low key flying in the Philippines. That way, my family would not know. I even posted something on my private page that I was flying to Europe to confuse my mom a little bit because it was a little surprise. All right. And that was the reason why last Dr. Nurse Paul Secrets of Next Gen NCLEX on January 7, I was not able to like join you guys because I was actually on the flight to the Philippines at that time. And so I recorded a video at 2 a.m. when my flight was 7 and the show was 8 a.m. So I guess it worked. Okay. But that was just a preview of what Next Generation NCLEX is all about. Now, if you guys are wondering what Next Generation NCLEX is all about, this is actually the seventh episode that I'm doing since last year. So all you gotta do is go to YouTube and find Dr. Nurse Paul Show, and you're gonna see the playlists there. Find the one that says Secrets of Next Generation NCLEX, and you're gonna see all the things that I talked about NGN or Next Generation NCLEX, and all the sample questions and case studies that I've done in 7 episodes. This is 7 episode actually. But you're gonna have a lot of things that you can learn about Next Generation NCLEX. And who are the people that will be taking the Next Generation NCLEX? It's the people that will be taking the NCLEX after April 1. This is a very significant change. We haven't done this significant change in decades over the lifespan of NCLEX. This has started around late 1990s, right? At this time, we're going to introduce new item types, new scoring system, and there will be case studies and standalone questions, right? Today, we're going to focus on the standalone questions. Again, to join the show, make sure if you want to win NCLEX review package, I know there's a lot of people who won already in the past. Every time I do the next generation NCLEX class live, I give one review package to a lucky winner for the night. So if you guys are already my students in Aspire RN, or if you have already won the Dr. Nurse Paul review package, can you guys say that in the comments that you guys are already my students so people would know that we have students watching today? And we're still waiting for more viewers to come in. I'm sorry that we're starting late today because of the technical issues. All right. Again, to join the show, make sure that you like Dr. Nurse Paul Inspire RN. We have to be able to verify that. Share this live show to your page from the Dr. Nurse Paul Facebook page. Somebody said in the comments, I could not share it because you're in another page. Go to Dr. Nurse Paul page, type it in Facebook, Dr. Nurse Paul. You see the live on the top of the posts and share that from there. That's the best way to share that, and we can actually track your shares and comment hashtag Dr. Nurse Paul, right? So again, go to the Dr. Nurse Paul Facebook page, type it in Facebook, Dr. Nurse Paul. You see the live on the top of the posts and share that from there. That's the best way to share that, and we can actually track your shares. And again, We have someone from Singapore. Thank you guys for joining. How about the others? Where are you guys from? Let me know so we can um, let the people know who are watching right now where we all are coming from. Okay? Do you guys still hear my audio? I hope you do. Guys, you only need to put hashtag Dr. Nurse Paul once, all right? And that way we can see the chances for other people, all right? I mean, we can give more chances to other people to also win the show. Only do once, or the algorithm might automatically block you because it's a live show. I don't want you guys to do that. We have viewers coming from Hawaii. Hi, Hazel and Jing from Riyadh. And we have someone from Ghana. I'm sorry, Rafi, you from Ghana. Tanuja from Sri Lanka. So we're hitting a lot of countries today. Okay, guys, if my audio and video is lagging, it's because, like I said, I'm having internet issues where where I'm located right now. That's one of the problems with doing live shows, but don't worry, this is recorded on my computer. It's also recorded on the cloud. So we're gonna upload a complete version. All right. After this show, if ever I get cut off, I'm gonna try to go back again or go back in again. But don't try to leave until we finish the show. Or if there are parts that you guys can understand because you can hear the audio, you can see me. Don't worry, guys, because what we're gonna do is we're going to record this and make sure that you guys can still watch it after this show because I'm going to be sharing important things today. We have more people coming in from Manila. Thank you guys for joining. Okay. So please make sure to tag your friends um, and make sure that they're following this show today. We have people from Saudi Arabia, Eastern region. I'm going to enroll in a few days. Need tutorials for the NGN. Very good. And we have special announcements that I will do next week. Actually, we will launch our new NGN Ready program. So stay tuned next week or follow me on my social media channels and Aspire R, and we're going to announce the new changes to my program, to the Aspire R and Netflix program, where you will have NGN classes built into your classes already. I went back to my drawing board and make sure that the curriculum that I have with Aspire RN is matching the NGN competencies. This is the only review center for foreign graduate nurses like you and me to actually um, ensure that you guys are NGN ready by the time you take the exam. Okay. Thank you guys. And we have more people joining today. All right. Now let's continue with your NGN. Like as I was saying earlier, let's make my face a little larger, although my camera is not the best right now. NGN questions will have a minimum of 85 items and a maximum of 150 items. I don't understand what she said there, Riza. I'm sorry. She said you're already in VEC. I don't know what that means. I'm sorry. But engine questions minimum is 85 items, maximum is 150 items. 15 items from those items will be pre-test, which means they're not recorded. And you will not know that, by the way, because they will not tell you what is post a pre-test or what is not. Right? It's just a way for them to figure out if the questions they're developing can match the NCLEX competencies. So in the minimum items, 70 items are scored. In the maximum items, 135 items are scored. 15 items would be pretest, right? In the minimum items, you would have about 60% standalones. Standalones are trends that we're going to talk about later, right? So this is about 52 questions will be standalones and 18 questions would be case studies. And in the last many shows from episode 3 and episode 4 and episode 5, I've been talking about case study nonstop. I gave you guys different scenarios for case study. If you haven't watched that, please go to my YouTube, Dr. Nurse Paul Show, and you can see the past shows that we did already arranged by playlists, and you can see what we talked about there, right? But today I'm going to focus on standalone questions, all right? And this is equally important because I mean everybody's prepared for case study, but standalone question is actually 60% of your exam, assuming that you're taking the minimum items. Now for standalones, there are two types of standalone questions. There are trends and Bowtie, all right? Trends and Bowtie. Thank you for those who are just barely joining. We have a free or a giveaway of an NCLEX review package from Aspire RN tonight. If you guys want to win an NCLEX review package, the mechanics is at the bottom of your screen right now. All you gotta do is like and follow Dr. Neurospal and Aspire RN Facebook pages. Share this show to your Facebook profiles via the Dr. Nurse Paul Facebook page and comment hashtag Dr. Nurse Paul during the live show in your comment section where you're watching right now. Okay. And I have friends that are joining in today. We have TCR Customer Assistance Service giving us hearts. This is Miss Anna Cruz and the TCR team. Thank you for being with us today. TCR team is one of our partners. They process PRCs or licenses and school documents for those who are in the Philippines. Our biggest clients is still Filipinos, but if you guys need help with processing your licenses and school documents, and you're from working from another part of the world, then you guys can call TCR. Send them a message right now on Facebook. Thank you, TCR, for being with us today and watching our show. Thank you so much. We love you too. Thank you, Miss Anna and TCR team. And anyway, so again, today we're going to talk about standalone questions. Standalone questions, there will be trends and bow tie. And we're going to talk about what are trends and what are bow tie. All right. Hello, everybody. Thank you, Roxy. Hello. Thank you for joining us today. And so many people are joining us today. Riza said earlier, she said, "Sir, you're already on the vac." I didn't understand what she meant by that. She said, "I'm already on vacation." Yes, I am, but I don't want to miss the Dr. Nurse Paul show again. I want to try my best to be here on my seat. But, struggles because I'm in the Philippines. Internet can be spotty. All right. But thank you guys for being with us today. And again, if you want to win an NCLEX package, the mechanics is at the bottom of your screen. All right. So again, let's go back to standalone questions. What are the two types of standalone questions? Again, we have the trends and bow tie, which is actually the things that we're going to talk about today. And more people are coming in. Thank you guys. And I apologize again at the beginning of the show. There was a technical issue. My computer is malfunctioning, the Wi-Fi is malfunctioning, and my camera, actually it's a camera, actually messed up everything. I have a small camera right here. It's a 4K camera that I always use with a ring light. Very, very efficient. But today it gave up on me and I can only buy it in the United States. So for now, we're going to make use of my ever dependable, but not the best, MacBook camera. All right. So you see my face right now looks so sharp and so it looked like I'm tired, right? Like I didn't sleep at all. I just came out from the shower before this show, but that's because of the camera quality. But it's okay. It doesn't matter. We're still gonna do this show, all right? And again, for trends, what are trends? Trends are situations or NCLEX questions that show nurses' notes that present a patient scenario. Think of the case studies that I've showed you in the past. Again, if you do not know what I'm talking about, watch my old shows. But this time, there's no case study. There's no 6 questions that will come out from a certain case. It's only one question, and it will only address one component of the clinical judgment model, right? I apologize for my voice too. I'm suffering from pharyngitis. The weather has been really a little brutal recently, and it's causing me a lot of allergies. But I'm getting there, getting better. Like I said, I didn't want to miss the show because I want to be able to share to you guys the importance of why we need to prepare for the next gen NCLEX because there are so many changes, right? And I need to give this information out to you guys to make sure that you guys are aware of the changes, right? We have Sir Marcus here giving us hearts. Thank you, my friend Marcus. Thank you for being with us today. Again, let's go back to trends. It shows nurses' notes that present a case scenario or patient case scenario. And there's only one question for each trend. That's why it's called stand alone because it's only one question. There's no developing case like case studies and it only addresses one component of the clinical judgment model, which is see on your screen right now on the right side, or is it the left side? I don't know. My screen is flipped, but it's on the side, right? I think it's on your left side. And trends can be any of the 13 item types that we see in the next gen NCLEX, which is actually the chart down at your bottom of the screen. So we have multiple choice. It could be multiple responses. It could be drag and drop. It could be close. It could also be hotspot, or it could also be matrix. All right. So those are the new NCLEX types that will be um, coming out in your next generation NCLEX. If you guys are not aware of what types of questions are these, this has been discussed in the episode 2 of of the Secrets of Next Generation NCLEX by the Dr. Nurse Paul show. So go to my YouTube playlist and find season 1, episode 2 of Secrets of Next Generation NCLEX. And I've showed different types of questions there, even as far as how they look like on the screen and how will they be scored, because there's different scoring systems now. So there will be matrices, there will be hotspots or drag and drop, there will be closed questions, there will be multiple responses, there will be tables. All right. So tables are going to be in drag and drop and close. There will be multiple response selects, and there will be multiple response selects, all that apply. There will be rational types of questions, which is a closed type of question. So many changes. But trends only address one question and one component of the clinical judgment model. All right. Sorry about my voice. And the other one is Bowtie. And last week in my Dr. Nurse Paul show, The Secrets of Next Generation NCLEX, I've showed you guys an example of Bowtie. So similar to trends, it will also show a nurse's note that presents a patient case scenario. If you remember my old shows, right, on one side, on the left side of the screen, is your patient case scenario. On the right side is your question. All right. So in the bow tie, it's only one screen. You will not have a lot of screens like case studies. Case studies is one screen per question, but same situation, right? In bow tie, there will only be one case scenario, but there will be 5 questions. These 5 questions will address the 6 components of the clinical judgment model. So it's a very distinct item types. I've never seen this in other boards, licensure boards. Only nursing, particularly the NCLEX, is using this type of question to evaluate your ability to practice as a nurse. So your licensure as a nurse in the United States, Canada, and Australia depends on your ability to answer questions of the next gen NCLEX, including the bow tie. All right. So in the bow tie, you see like a butterfly or a bow tie structure in the middle. You want to put there your diagnosis or assessments. In one side, on the left side, you want to put there actions to take. And then the other side, you have what you call parameters to monitor. What you're going to do is you're going to drag and drop your choices to these boxes. And I'm going to show you later what it looks like. So again, bow tie compared to trends addresses the 6 components of the clinical judgment model, from recognizing cues to analyzing cues to prioritizing hypotheses to generating solutions, taking actions, and evaluating outcomes. Okay? Any questions so far from the crowd? Right? Please make sure that you have shared this show and it's public, so our staff members or team members will validate your entry later, and to ensure that the winner actually won by following the mechanics. Okay? And let's now go to your sample questions. If you guys are ready, I'm about to show you the sample questions. All right. Let's see what trends is all about. Remember, trends is only one question and it only addresses one component of the clinical judgment model. All right. So let's see. You guys can hear me clearly, right? Making sure that I'm doing it correctly and there's no technical issue. Yes. Yes. All right. Okay. Who will be taking the next gen NCLEX here, by the way? Do you have any questions for me about the NGN next gen NCLEX before I proceed? I know I've had a lot of questions in the past, but I wasn't really able to like address them um, directly because this show is a little fast paced and I only have 1 hour to do the show, right? But thank you guys, thank you, and more people are coming in. Thank you guys. Appreciate your participation. But you're gonna answer the question with me today. All right. I'm gonna flash a question, and you're gonna write your answers. All right, to the in your comment section. All right. So remember, my 3 favorite words is yes, I can. All right. That's what we always tell ourselves in the morning when there's challenges. You say, yes, I can. Yes, I can do it. Yes, I can finish my tasks. Yes, I can pass the NCLEX. All right. So if I ask you guys, can you pass your next gen NCLEX? You say, yes, I can. Can we all do that in the comment section? Let's put all caps. Can you pass your NCLEX? What is our answer there? Yes, I can. There you go. Somebody else has put May is going to be taking her exam in May 29th. So please include her in your prayers and give support to our friend who will be taking the NCLEX. Good luck, May. Yes, I can. There you go. There you go. Let's manifest this positivity that you can pass your next gen NCLEX. This is just another challenge. All right, but you're going to get through this. We are going to get through this together. Dr. Nurse Paul will always be here to do free shows for the secrets of next generation NCLEX, and that will be every Saturday. So make sure that you follow the Dr. Nurse Paul in social media. I put out little videos and reels here and there in TikTok and Instagram. We've been heavily putting out a lot of videos every day. I've recruited a group of people that will help me push out those videos faster because I couldn't do it alone by myself anymore. I'm getting a lot of questions and sometimes I couldn't respond quickly, but rest assured that we're trying our best, me and my team and the Dr. Nurse Paul and Aspire RN, to get to all of you as fast as we can. But please don't hesitate to send a message in my Facebook. We have staff members, team members that are waiting for your questions, and we will be ready to answer you. And most of the time, I still come in and make sure that I answer your questions myself. All right. But Dr. Nurse Paul and Aspire is growing so fast. So I needed to recruit people to help me push out these little videos. So follow me on TikTok, Instagram, and Facebook. We're giving out all these tips for free. We're giving all these encouragement videos. We're giving out all these dream board types of videos where you can be motivated and inspired to pass your NCLEX. How is it to have your American dream or Canadian dream or Australian dream fulfilled, right? So follow me for more events too. We do shows every Saturday, okay? If you guys are ready, let's go to trends. Remember, trends is only one question, but if you look closely on your left side, right, you see the nurse's notes is evolving. We have notes from 10 o'clock, from 14 o'clock to 18 o'clock. That's what trend look like, right? So you see two parts of the page right now, which I've mentioned in my past shows. On the left side, is a question or patient care scenario or clinical scenario. On the right side are the questions and options that you need to choose from, right? So let's read this together, people. The nurse in the emergency department is caring for a 10-day-old client. We have a neonate as our client, all right? At 10 o'clock, patient reports that the client has been vomiting after drinking each bottle of formula. Parent estimates that the client is vomiting half of each bottle with each feeding. Client is triaged, vital signs is 97.7 Fahrenheit, pulse is 124, RR30. They all look normal to me, right? Let's see the trend. At 14 o'clock, 2 p.m., this is like, what, 4 hours later, right? The client experienced projectile vomiting 30 minutes after drinking 60 ml of formula. Anterior fontanelle is soft and flat. Is that a normal finding? Bowel sounds are hyperactive. Is that a normal finding? I don't think they're normal finding, right? Anterior fontanelle should be bulging. If it's flat, it's a sign of dehydration. An hyperactive bowel might be a sign of diarrhea or, vomiting, right? So hyperactive intestines and stomach. That's what it's saying. At 18 o'clock, this was like 4 hours later again. So this at this point, we've been seeing the patient for 8 hours. Client experienced projectile vomiting 30 minutes after drinking 60 ml of formula. Abdomen is distended. Client is crying and inconsolable, right? So, which means what? Which means that the patient is uncomfortable. The patient keep vomiting every time the patient is fed, right? I'm sorry, Chiyomaka. She says she couldn't see the questions. This is as large as I can put it on the screen because I'm trying to simulate what it looks like in next gen NCLEX. So this is a full screen mode that I can view it, right? That I can do it. If you're watching from your phone, you'll be probably have a hard time reading this, but you can zoom in, right? All you got to do is put your screen on full screen and then zoom it in, right? In the actual NCLEX, you'll have probably a 17-inch screen and you can see all these questions properly. All right. So, what are we guys thinking before we go to the questions? The question in options. What are we guys thinking? What are your differential diagnoses? We say that in medicine, right? But what are the things that you need to prioritize? What is going on? Why is a 10-day-old projectile vomiting every time there's feeding? What are the things we're talking about here? There could be problems with the trachea and esophagus, right? Atresia is a possibility, but atresia would have drooling, right? Aspiration. Patient will have hypoxia, coughing, right? Cyanosis. Those are the signs of atresia, which means the esophagus or trachea is either not connected or connected improperly. But another condition that can cause projectile vomiting for babies is, Michi said it. What is that, guys? Pyloric stenosis. All right, the patient is most probably showing signs of pyloric stenosis, right? Pyloric stenosis is, of course, the abnormal occlusion of your pyloric sphincter found at the bottom of your stomach, leading to your duodenum, right? So when this is obstructed, what happens is the pressure exerted by the stomach to drain the food downwards causes the food to go upward, and there will be projectile vomiting every time the patient will feed. So there is a high probability that this is projectile vomiting, but it could also be just acute gastroenteritis, right? Now, considering this differential diagnosis, let's go now to your question. Which of the following diagnostic procedures should the nurse anticipate the physician would order? This is a select all that apply question. This is a select all that apply question, right? Which means if this is a select all that apply question or SATA, this is a correct minus incorrect scoring system, all right? So what are your answers? We have barium enema, abdominal x-ray, abdominal ultrasound, complete metabolic panel or CMP, and esophagogastroduodenoscopy. What are your answers? Show me your answers right now. Come on. Right, show me your answers. Yes, you can. Let's see, let's see. All right, remember, this is a select all that applies, so you have multiple answers. But also, this is a correct minus incorrect question. All right? If we're talking about acute gastroenteritis and possible pyloric stenosis, what are your answers? Other symptoms of pyloric stenosis, aside from projectile vomiting, is a distinct olive-shaped mass when the patient is palpated on the stomach, right? So that means there's a stenosis, and usually the treatment is none other than surgery, but the doctors can put an NGT to dilate that, right? But let's talk about diagnostics first, right? So people answered 1, 2, 3, 4, 5. All right. Remember, this is a 10-day-old client, guys. This is not a 70-year-old. This is a 50-year-old. I would ask you guys to think about your answers again. Think about your answers again. Is this appropriate for for a 10-day-old baby? This is a 10-day-old baby. Have you seen a 10-day-old baby? In the ER, they're so tiny, like this, right? What you're trying to tell me is you're doing all these tests to a 10-day-old baby. Think about it. Think about the appropriateness and the safety of the procedure for this baby. More people are coming in. If you guys have just joined the show, thank you for joining the Dr. Nurse Paul show. We are doing the secrets of next generation NCLEX today. So please, 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 please share this to your page. And if you're lucky, you can win one NCLEX review package. All right. So comment hashtag Dr. Nurse Paul during this live show if you have shared this to your page. All right. Again, let me give you guys a clue. You're not only answering the question by telling me the diagnosis for pyloric stenosis, you're also considering the age of the patient, because when we are presented with a case scenario, you want to see the whole picture. You want to get all the vital information to help you answer the questions. All right. What are we going to do? Anyone? This is a right minus wrong, right? Question. Anyone? All right, let's see. Let's see. The answers are, you guys ready? The answers are 3 and 4. Can you guys see the check mark? 3 and 4. Barium enema is not indicated at this point. That can wait. It's not a priority. The patient is in the emergency department. We're only going to do emergency diagnostic procedures. If barium enema is required, we need to have a clearance from the gastric specialist, gastric neonatologist, or gastric pediatric doctor. All right. So barium enema is not needed. That's too much of a stuff that we do for 10-day old. All right. We can diagnose definitely pyloric stenosis without the need for barium enema. All right. How about abdominal X-ray? Many people answered abdominal X-ray. I'm sorry, you're gonna get a penalty for this. Um, for this, if you answered abdominal X-ray, guys, are you willing to expose a 10-day-old baby to an X-ray that's about 1 to 10 millisieverts that could possibly cause cancers and leukemias and many other problems in the future? If this was your baby, are you gonna be okay with it? Yes? No? 10-day-old X-ray. On a safety standpoint, evidence-based medicine, do we need to X-ray a baby that we're suspecting with pyloric stenosis, or maybe ultrasound is enough? Ultrasound is more specific and sensitive than X-ray. What can you see in X-ray? Distended abdomen, what gases in the abdomen, what immature ribs, immature bones in the body, right? And then what? Then what? We're not gonna see a pyloric stenosis. They're probably a shadow of the stenosis, but that's soft tissue, guys. Abdominal ultrasound will be more specific and sensitive at this point. Plus, abdominal ultrasound is safer. It does not have radiation. It's super easy to do and it's cheap, right? So we're not gonna do X-ray. We're gonna do ultrasound. Remember, this is a 10-day-old baby. If this was an adult, you can be as aggressive as you want, right? And what is CMP? There are many people that did not answer number 4. They probably don't know what CMP is. CMP is a blood test. It's Chem 8 in other countries, right? This is a test that tests all your kidney profile, liver profile, glucose, electrolytes, your acid bases, your bicarbs, and your CA levels, right? All of these, that's called CMP. All right, all of these are vital information to tell us if the patient's already having signs of dehydration because the patient's vomiting, right? So that's important. And of course, EGD may be required later on if the doctor is preparing the patient for surgery, but that's not the answer right now. So CMP is a blood test. Check your potassium, your sodium, your chloride levels, your glucose level, your HCO3 level, your CA level. What else? Your ALTs, ASTs, right? Creatinine, BUN, and so many other tests. All right. So answers 3 and 4. For those who answered more than 3 or 4, I'm sorry, but your correct answers will be deducted from your incorrect answers. So if you guys have incorrectly answered this, because there's only 2 answers, I'm afraid that your score is 0. Okay. But this is what trend is all about. Don't worry about it. Okay. That's why we're doing this so everybody can learn, right? But this is what trends is all about, right? It's a singular question. There's no follow up. There's no case study. Similar to case study, but there's only one question. There's no case. There's no follow up. There's nothing that happened next. But you would usually see multiple timestamps on the nurse's notes, multiple entries. There could also be another tab such as history. There could also be another tab such as labs, but it's only one question. Okay? Did you guys understand this? Do you have questions? No? You guys, we are giving you 5 more minutes to join the Dr. Nurse Paul Show giveaway today. We are giving you 5 more minutes to join and to win an NCLEX package from Inspire RN. I'm sorry about my voice, I'm about to lose it. Make sure that you follow the mechanics at the bottom, like and follow Dr. Nurse Paul and Inspire RN, and share this show on your pages and comment hashtag Dr. Nurse Paul, right? During this live show, we're giving you 5 more minutes, okay? Now, let's go to Bowtie, and I've given you examples of Bowtie before, all right? But you guys, it's okay if you made a mistake in the previous question. That's why we're here. That's what I do. I'm an instructor. I'm an NCLEX expert. I'm trying to help you guys critically think, right? Because you all need to see this the big picture. You're not only treating a patient, you're treating a neonate that probably don't need many tests that could potentially increase the danger rather than helping the baby. It's always about minimizing the risks. All right, it's always about what's will benefit the patient more. Okay, so be very careful with your answers last 3 minutes to join the giveaway. All right, now let's now go to Bowtie. Remember, Bowtie is another standalone. When I say standalone, it's only one scenario. It's not a case study that evolves, that gives you six questions, right? And I already discussed case studies and I give you examples of case studies in episodes 3, 4, and 5 of the Secrets of Next Generation NCLEX late last year. So if you haven't watched that, well, go to your YouTube now and you can see my playlist there, Dr. Nurse Ball Show, right? Bowtie is a standalone question. Good thing with Bowtie is it's a 0/1 scoring system, which means you only get points for everything that's correct. If you have an incorrect answer, that doesn't cost you any deduction at all. All right. So this is one of those kind of straightforward scoring system that whatever correct answers you get, that's your points. If you get 1 out of 5, then your score is 1. If you get 3 out of 5, then your score is 3. Okay. So let's see this, guys. I'm going to read it to you. If you guys can see it clearly, I'm going to read it to you as well. All right. So the client is admitted with increased irritability. All right. Sorry. Let's go to the start. All right. The nurse in the pediatric unit is caring for a 6-month-old client. This is another pediatric question, right? Client admitted with increased irritability and a leaking gastrostomy feeding tube, which was placed 2 weeks ago for failure to thrive. The feeding tube insertion site, which is on the left side of the abdomen, is covered with a dressing that is saturated with old formula. Again, if you cannot read it, just listen to me. On removal of the dressing, the skin surrounding the feeding tube site is erythematous and flaking. At the insertion site, a small amount of thick, yellow drainage is noted, and the feeding tube is loose. Peripheral pulses are weak. Capillary refill is 3 seconds. Extremities are cool to the touch. We're all seeing abnormal findings here, guys. Client is intermittently pulling at the tube and scratching at the site. Parent reports giving the client acetaminophen last night before bedtime, but the client was still intermittently waking and irritable throughout the night. Parent attempted to feed the client through the feeding tube 8 hours ago. Vital signs: temperature 100.6, that's fever, 171 pulses, a little high, but I mean, up to 180 is normal. 42 is normal respiration. Blood pressure 74/62. That's quite normal for a 6-month old, at least over 70. Pulse oximetry reading is 97% in room air. Parent has a history of penicillin allergy. Okay? So, what's the first issue that we find here? Whenever we get case scenarios like here, like this, what is the first issue that we find? Right? You guys are already complaining to me that you guys cannot read your screen, correct? Why? Because there's too much information on the screen, right? There's only so much space that I have on your screen right now that I could fit these questions, right? So see, that's the problem right there. In the previous NCLEX formats, the questions can only be 1 to 2 or 3 lines long. This is a whole information or a story about a patient. You've just read about 200 to 300 word scenario. That's only the scenario, right? So for people who have hard time reading and reading is not their strongest strongest quality, well, that could affect them to answer the next gen NCLEX, particularly for trends and bow ties and case studies. All right. So be very careful about that. Train yourselves if you're gonna do next gen NCLEX to read long questions, to read case scenario questions. I keep repeating, if you guys are going to take next gen NCLEX, make sure that you are practicing questions that are in next generation NCLEX format. Or you can also join me in my classes beginning February. We're going to do NGN or next generation classes to be handled exclusively by me. Of course, in my team, there's a lot of instructors because I have different phases. I have 42 live sessions in my classes. Other service providers would only have 20 or 15 or 18. That's not enough to help our foreign grad nurses to pass the NCLEX. I have 42 I just recently added 8 more days. That all we do in 8 days is talk about next gen NCLEX, give you questions. We're gonna answer it live. That's only for students enrolled in Aspire RN. Here in the Dr. Nurse Ball Show, I do 1 hour classes. In Aspire RN, I do 4 hour classes every time I'm seated on the camera. So there's a difference, but that's because these students are enrolled with me, so I have a commitment to make sure that they really pass. And I develop relationship with my students, make sure that I know them, make sure that I can track their performance through my classes. Okay. But anyway, going back again, reading is very important. Comprehension is very important. We are now seeing very long case scenarios with about 200 to 300 words, some of them 500 words, just only reading the scenario. If you guys are running out of time, this could potentially make or break your performance in the NCLEX. If you guys are getting a lot of case studies and trends, this can potentially affect your 5 hour time limit and you're going to run out of answers. So practice with a lot of next gen NCLEX. All right. All right. Anyway, so now considering the question, let's look at your considering the scenario. Let's look at your question. The nurse is reviewing the client's assessment data. We're now looking at the right side to prepare the client's plan of care. We're gonna look at the bow tie now. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. We're gonna start in the middle, right? The condition most likely experiencing. 2 actions the nurse should take to address the condition. We're gonna answer action to take next. And then the last one would be the 2 parameters the nurse should monitor to assess the client's progress. So by doing the bow tie, you're addressing the 6 fundamental components of the clinical judgment model. It's just bundled into one question, right? So expect that bow tie questions will always be long. If you see this question and you're already on your number 42, number 60, number 70, and you feel overwhelmed because at this point you'll be so anxious with your NCLEX, right? So many things running in your mind. Am I going to pass? Am I going to pass? Why are all these easy questions? Why are all these so hard questions? Why are all questions that I don't know coming up? You'd be anxious by this point. If a bow tie question pops up, close your eyes first, all right? Close your eyes first and tell yourself, yes, I can, right? And then open your eyes and start answering the questions, right? You gotta relax, reduce your anxiety. Anxiety will not help you in your NCLEX. But those are some of the tips I teach my student when I do my classes, all right? Anyway, going back, let's see. So we said we are gonna focus on the bow tie, and in your actual NCLEX, what you guys are gonna do is drag the options from the bottom, all right? You see the colors, you match the colors to the bow tie at the top where the square red box is. You're not gonna see the square red box in your NCLEX. It's just a box that I put so you guys can look at where I'm telling you to answer the questions, right? So again, let's start with conditions most likely experiencing, right? Conditions most likely experiencing. What condition do you think is the patient most likely experiencing? So what condition do you see that the client is most likely experiencing? Anyone? You see the situation, right? It's talking about wound. It's talking about leaks on the gastrostomy because the patient's not feeding properly. It's talking about temperature being elevated. It's a sign of fever or infection. It's talking about extremities being pale, capillary filler too long, so the patient's already developing hypoxia. This is looking like what? For me, I'd be honest with you, this is my answer. You can take it as an opinion or you can take it as an expert answer. Up to you. But it's infection of the gastrostomy tube side. The patient's already manifesting signs of sepsis. And this is very dangerous to pediatric patients, right? Particularly those infants. You know that 60% to 70% of their body composition is water, right? That's why they easily get affected by dehydration complications. And honestly, I've seen kids die from dehydration. I'm an ER nurse. I worked in the pediatric ER. Sad story. Can easily be averted by ER managements, but it happens. So be very, very careful. Look at the NCLEX. What it's doing right now in the next gen NCLEX is it's measuring your ability to recognize cues and analyze cues. This is the first 2 steps of the clinical judgment: recognize cues and analyzing cues, right? All right. And then, of course, you're doing prioritizing hypothesis. That's why you were able to do the potential conditions, and you're gathering information. That's why you read the situation. Now let's go to the fifth part of the clinical judgment model. Let's go to actions to take. All right. What are two actions that you guys need to take? What are the two actions that you guys need to take? I see some of our students here that are already here. Again, okay. Mama Rita said, read the choices. I can't read. It's very small. All right. So for actions to take, your options are change the dressing, request a wound selection consultation, obtain an EKG, request a bolus of intravenous zero point 0.9 sodium chloride. I can even read it myself. And the last one is reassure the parent that the site findings are the normal progressions of healing. All right. We're going to focus on the green boxes, actions to take. All right. What are your answers? Can I see? You have two answers, right? Two answers. Let me see. I'm sorry, guys, that it's too tiny. In the NCLEX, if you have a 17-inch LCD screen, for monitor for computer, you're going to see the whole screen filled up because of these questions. And honestly, for an average student, this is overwhelming. I mean, whenever I read my NGN questions to you guys, I get overwhelmed too. Like, I have to sift through the information that I need to read thrice to make sure that I'm not missing something. You got to do the same, right? I don't want to miss a situation. As a nurse, it's my responsibility that I get accurate information so I know what's going on, right? What are your answers? I'm seeing correct answers now. Hmm. Mm-hmm. I think we're divided about the dressing in one consultation, huh? All right, we're gonna remove EKG because nobody answered it. We're gonna remove reassure the parent. Why would you reassure the parent that this is normal? It's not even normal. All right, the patient's already developing sepsis. Okay, so request bolus is correct. If this is sepsis and the patient's already about to have sepsis or hypovolemic shock from sepsis, we need to give bolus of fluids, right? For pediatric patients, I'm just telling you the guidelines in PALS, PALS, or Pediatric Advanced Life Support. We can give from 20 ml per kilogram up to 60 ml per kilogram. We're very aggressive. For adults, we only do 20 to 30. The reason being, pediatric patients have more water body composition, right? So definitely bolus of water, we're going to answer that. But what about the first two? What am I going to choose? Change the dressing or request a one consultation? I like it when it's interactive this way because I'm trying to pick your brain and try to see how you guys think. It's critical thinking. What do you think? Change the side dressing or request a one consultation? Anyone? Remember, back to the question. It says choose two actions the nurse should take to address the condition. What would address the infection of the gastrostomy tube site? What would address the infection of the gastrostomy tube site? What would address? All right? Guys, I'm going to be honest with you because I don't think um, a lot of people, well, we're divided right now, okay? Let me tell you something, okay? You can take my answer as an opinion, which means you can have your own, or you can take it as an expert answer, all right? Let me tell you this. If I'm a near nurse, if I'm a pediatric nurse, I'm going to tell my hospitalist to call the wound doctor, infection preventionist, infection control doctor, or wound care nurse. You know why? If I change the dressing and throw away the dressing, what if they suddenly ordered for wound culture or culture and sensitivity of the secretions, of the dressing, of the thing around the skin, right? So I would consult the specialist first. I would phone the hospitalist, hey, we need to get the wound team, the wound care team, the wound specialist in the team. We need to collaborate with them. They need to start putting orders. And the orders would be take a photo, measure the wound, culture and sensitivity. We do wound culture, send to the lab, and they see the patient face to face, right? Versus if you only change the side dressing, yes, I understand. The dressing is leaking, but you put a temporary patch. You temporarily changed the situation. You did not address the main problem, which is infection from the gastrostomy tube. Somebody has to look at that wound, why it's getting bigger, why it's getting swollen, what is going on. All right. So, what is our answer, guys? You guys understand me, or are you guys hating me right now because my answer is different from you? Are you guys hating me right now? Sometimes we have disagreement and that's normal. And people are like, I don't trust you because my answer is different from you. I'm not the one taking the answer. It's up to you guys. Like I said, you can take this as an opinion or you can take this as an expert advice. It's really up to you. Just like what we tell our patients when we give them discharge teachings, right? Health teachings. I prescribe a medication and I give them, education about examples of complications and all that. Why you shouldn't be taking this medication? Why I should be doing this and that. And that. I always tell them, take it as an expert advice or opinion. Really up to you, right? It's all right, guys. It's all right. I know, I understand people are very passionate about wound dressing, all right? Because every time we go to the hospital, we see a wound, we patch them. I know we're all nurses. We love to clean up our patients, but we need to address the main problem. It's infection of a wound of a gastrostomy. Then we need to get the specialist on board to get those orders in. We need to address the main source of infection, which is that wound over there. Okay? Got it? Got it? Okay. All right. All right. Nobody's hating me yet. We're probably going to see them later on the replay. All right. Okay. Now, parameter to monitor. Let's wrap this up. What's your parameter to monitor? I need to wrap up because we're beyond the schedule already. What's your parameter to monitor? The options for parameters to monitor are stool output, skin integrity, feeding intolerance, vital signs every 30 minutes, parents' ability to administer a tube feeding. Now, here's the thing. When you take an action, it's connected to your parameter to monitor, right? You got me? Whatever you put in the take to the action is connected to your parameter to monitor. That's why you see lines connecting those bow ties, correct? They're related because they're part of the clinical judgment model. Whatever you take actions for, that's your intervention, step five of the clinical judgment model. You need to evaluate that after. Did it work? What didn't work? What should I do next? Right? That's evaluation. So if I request a wound consultation, what do I check? Skin integrity. If I request a bolus and I give bolus, what do I check? Vital signs every 30 minutes, right? So they're all connected. If you hit the right answer at the beginning, which is the condition, then you're going to get all the things correctly. It should be fairly easy. But here's the caveat, all right? Here's going to be your pitfall, right? If you didn't understand the situation and you didn't read it properly or you missed something, especially it's in the screen. I know a lot of people like to write, like to, when you're doing, that's why, okay, let me say this, right? I've seen a lot of nurses prepare for NCLEX, particularly foreign grads. It doesn't happen here in the States. They still print out the exams and answer on the exams on the paper. In Aspire RN, we never use paper exams. We all use a program where you do your quizzes online. That's part of your computer training. You're not going to be able to encircle, highlight, underline important or critical parts of the questions. You're going to look at your screen. So that's part of the training. If you are still in your classes and you're still printing papers to take your exam, you're not getting the right deal. You're not getting the right way of preparing for the NCLEX. In my NCLEX program, I prepare the students not only knowledge wise and comprehension wise, but also skills wise. Test taking skills, test taking ability, stamina for taking the exam, stamina in reading 500 question scenario. All right. Test taking techniques. All right. How do we answer these questions? How to relieve anxiety during the exam? What am I going to do if I want to urinate and I'm in the middle of the exam? What am I going to do if I'm about to pass out and I'm doing the exam? I'm doing all this. It's a holistic approach that we do in Aspire RN. So make sure that you're partnering with the right team. Okay. Now, make sure that you guys read the questions properly because if you missed something, it's going to be your pitfall, right? Any questions about bow ties and trends? Any questions about bow ties and trends? Now's the best time to do it. Thank you guys for joining. Some people are giving bad reactions already. They probably didn't get it right. No, no. Antoinette's question is, and let me show that, says, is this type of question right minus wrong? No, this question is only 1 point. My camera is horrible. I'm sorry. This question is only 1 point per answer, right? So there are 5 answers If you only get three or two or four correctly, then that's your score. There's no right minus wrong, right? If you guys are so confused with scoring system, I discussed this again in episode 2 of the Secrets of Next Generation NCLEX, which aired on the third week of October. Okay, you're welcome, guys. I appreciate you guys from joining for joining the show today. We reached about uh 200 plus viewers. We usually get more than that, but I guess today everybody's tired. I'm tired as well. But many people watch the show eventually. I would see people commenting as though they're watching my show live from the shows that I did 3 months ago, 4 months ago. It's funny because I'm like, what is this? Somebody's trying to answer my question that I posted 3 months ago. And that's okay with me. It means people are still watching it. All right. And this is only one part of what you're going to get if you join my next generation classes. If you are enrolled in Aspire RN, all right? We're going to do more drills like this, more practice, more test taking tips, all right? More expert advices from the NCLEX expert like me and my team, all right? Now, follow Dr. Nurse Paul as your next gen NCLEX expert. I will be here to make sure that you guys are getting the right information, correct information, and expert advices to help you prepare for your NGN. And if you're already enrolled in Inspire, then I will be one of your mentors. All right. Now let's announce the winner. Drum roll. Who's our winner? I think our team is ready to announce the winner. All right. We have our winner for our NCLEX package for today. And our winner is Tanuja Ratnayaka. All right. I think I've seen this nurse earlier. I think she's the one from Sri Lanka, if I'm not mistaken. Tanuja, if you are here, please send us a message now in my page. All right. In the Dr. Nurse Paul page, Tanuja, congratulations for winning tonight's NCLEX review package from Aspire RN. On top of that, you get NGN classes included in your subscription with Next Gen NCLEX. To those who were not lucky for today, you guys can join the Next Gen NCLEX shows and you guys can win as well. You still have chances, all right? And we have Dr. Nurse Paul show every Saturdays, 8 a.m. Central Standard Time. We have two series. This is the Secrets of Next Generation NCLEX. Another series is USA Nurse series. What I do is I alternate them. First and third Saturdays are Secrets of Next Gen NCLEX, hence why we're doing this today. And the second and fourth Saturdays are USA Nurse series. So it's alternating. Next week, we're going to do USA Nurse series for immigrant nurses. This is the season 2 of USA Nurse series, Living the American Dream. We're going to talk about culture shock and work fatigue. Very important things that need to talk about when you're migrating to another country. And I have so much to share, but I'm going to bring in two special guests. Watch out in my social media. We're going to announce that around Wednesday. They're going to join us to talk about what about work fatigue, what about culture shock, and what we did as immigrants to battle this culture shock and work fatigue and so many other psychological problems that affected us during our first few months and years in the States, in the US. All right. Thank you so much for joining us today. And you guys can send me a message in my Facebook, or you can also send a message to Aspire RN team in Aspire RN page. We have staff members, team members waiting for you to send that message. We're going to address your questions. You guys need help with NCLEX processing. We have partnered with NCLEX Pro to help you process for the state of New York and state of New Mexico and state of Texas. Those are the easiest states to apply as foreign grad nurses. If you guys are from the Philippines and you require assistance with processing your licenses and school documents, please contact us as well. We have a partner. It's TCR, The Choice is Right, Customer Assistance team. And if you guys are already nurses and are looking for scholarships or NCLEX scholarships, or you are looking for an agency because you haven't found your agency to petition you to the US if you're outside the US, then contact us as well because I have a lot of referrals. These are agencies that I vetoed myself, making sure that they are serving the community. If you guys are not aware, one of my advocacy is for the protection of immigrant nurses and, preventing abuse and, just people that have um, bad intentions for our immigrant nurses. I don't want our immigrant nurses to be taken advantage here in the United States. All right. Thank you so much, everybody. All right. And you guys have a good night. I'll see you in the Dr. Nurse Paul show next Saturday, 8 a.m. Central Standard Time. Bye.
You have just watched the Dr. Nurse Paul Show. Watch us live every Saturday, 8 a.m. Central U.S. Time. For more info about our future events, follow us on our social media channels. You can find us at Dr. Nurse Paul on Facebook, Instagram, TikTok, and YouTube. See you next week.